Okay. I'm going to combine another question that had a similar question regarding infertility, but they had another question in there. Another question they had was, I have had COVID before and I have built in a natural immunity to the virus. Do you still recommend that I need to get vaccinated? This is somebody who's trying to get pregnant. And if you do, which vaccine would you recommend?
I'd really appreciate it if you could comment on that before I do.
So the big problem with COVID, which is different from other viruses, is reinfections. Typically what used to happen is if you get the chickenpox or the measles or the mumps, you become immune to it, you're never going to see it again because that immunity used to last and was lifelong. The big challenge with COVID is reinfections. We're all seeing people come in with reinfection after a few months of the original infection. And it sort of depends on how severe the original infection was. So if a person ended up on the ventilator in an ICU and survived, chances are they have really good immunity against this. And it's going to last for, a year or more as far as we know for now. On the other hand, if someone just got an asymptomatic infection, it was a light upper respiratory infection, they had essentially no symptoms, well, then you make very little antibody against the virus, and you're not protected for more than maybe 3 months at the most. Now, in certain situations like pregnancy, pregnancy is an immunosuppressed condition, and any infection, whether it be original infection or a reinfection, can be a problem. So we do recommend, vaccination, even though a person's previously had the infection, just to prevent reinfections.
I concur with Dr. Bassi, and especially, after exposure, first 3 months, maybe there's good immunity, but beyond that, it's just hard to tell, and that's why vaccination is essential.
I'm sorry, I say the exact same thing to the patients. I think that's a very reasonable response.
Okay. Any questions from the audience?